Good morning, Dr. Alberic. It's a good opportunity to again remind my friends regarding 2 points yesterday you mentioned. I like it so much. Firstly, the most or one of the main problem during the complete denture is the stability of the denture.
Yes.
Yeah, you say that, and you mentioned a case how she has not been happy with her previous dentures. Then with the zebris, you could control the movements and you could give the stability.
I can give the stability of the dentures by adjusting the occlusal movements and to distribute this biting fall to the whole rim and not to very small areas. Therefore, it's very important to know the individual movement patterns that we can transfer this into the full denture. And with that, we have a combined guidance of the front and canine area and premolar and molar region on both sides. That is a so-called balanced occlusion of the full denture. And this can only be done with recording of the individual movements and with zebris and transferring it to our virtual articulator. That means we have to have a full digital workflow for full dentures. And it's the same with dentures supported by implants.
Yeah, that's the point. I like it as well to complement our speech. Yesterday you said the stability is going to let the patient to use the full denture, fully edentulous, functionally and to accept it aesthetically.
Yes.
That was a good point. The second one, you say even it is better for the fully edentulous if someone is placed implant because of the direction of the force. May you explain also something about this point?
Yes, when you have implants, you have to see that the load comes not horizontally to the implant. If we have an implant and the load comes horizontally, it will bend and press against the bone.
Yeah.
And with that, we can have bone loss and later on a loss of the implant. And to avoid this, the load distribution must be very carefully to all of the implants at the same time as a minimum load. And this can be achieved with good equilibrated occlusion.
Yeah.
And that can be done with our digital workflow with impression digitally and then recording the movements and the right positions for maximum intercuspidation and so on. And this can be transferred into a CAD/CAM system to design the occlusal surfaces.
That's cool. Lastly, you are about to have a very sophisticated, simple, and let's say time saving tools.
It's time saving.
Yeah. The one I was going to be developed under experimental.
Now it's experimental, but we tested it on some patients already, and it worked quite good.
Yeah, you are hopeful for that.
I'm hopeful for that. Sorry.
It's early morning.
It's early morning.
Yeah,
it's
time.
6 o'clock in the morning.
Yeah, exactly. It's 6 o'clock in the morning. And we are front of the Kempton Bahnhof train station. But there were a few minutes I take benefit of it. I consider as opportunity to get this point.
Yes.
So eventually you are hopeful that this simple instrument is going to help us in single visit to record.
Yes. All the important clinical data can be collected in one single appointment. The first part is to do individual or functional impressions. This must be done in a conventional way with individualized impression trays and, for example, silicon impression material and so on. Then we can determine the vertical dimension of the prosthetics, also analog with clinical or related to clinical findings. And the last step in this appointment will be to do a registration of the movements and to find the best condyle centric position, and this can be collected into one data set into the zebris system, and all these informations will be transferred to the CAD/CAM system, and then we can manufacture, let's say, mostly perfect full dentures.
I'm hopeful. I have seen yesterday very nice things. The tools they were promising, Lucas, and that you are humbly explaining very well. Thank you very much. We are in the front of the Bahnhof train station, and I will record a few frames for you. How is? Thank you for your time. Thank you for bringing me here at this early morning.
Thank you for visiting us here in Izny with zebris, and I hope I could give you some ideas what will come in the next time.
Thank you so much.